Kimberly Pratt. I'm the project coordinator for Suicide Education and Support Services, which is a program at North Range Behavioral Health. So about half of my job is suicide prevention in our community, and I cover Weld County, but I live in Fort Collins, so Northern Colorado is my place. And the other half of our job is responding to a suicide crisis in the community and all of the things that come between prevention and post-prevention as it relates to suicide prevention.
Thank you, Kimberly. I'm just going to start with our questions, and feel free to share what is on your heart, and really especially your experience so far during this COVID-19 crisis. So I wanted to start out with just really talking about the current challenges or experiences that you personally have had working in your community and with your clients. So how has your approach to care changed during this time?
You know, I think with like so many other people, well, one, I'm just grateful to still have work. I know that there's so many people out there who don't have work anymore. So the fact that I get to work from home is a huge, huge blessing. But it really, it felt like everything changed overnight. We went from in-person meetings and in-person trainings and community engagement to trying to find a way to get everybody connected online. And so that was certainly a challenge. Also working with people who have lost loved ones to suicide, doing that work over the phone, or over Zoom, there's just something about that human connection, that person-to-person, face-to-face contact. And so having to transition and make sure that our suicide loss survivors still feel connected and still feel cared for, and finding ways to convey that care over Zoom has been a challenge. Finding ways to, one of the things that we do is community coalition work, and trying to make sure that our community stays engaged and connected, because one of the biggest risk factors for suicide is isolation. And so there's been a real challenge to how do we engage people when everybody is going through massive changes. Everybody's whole routine got turned upside down. And so how do we work to provide them comfort and care in their own home while we're not with them? So that, I think that's been our biggest challenge.
So what, you may have already touched on this, but what are other things that you are most confronted with today?
Today we get the question a lot of, are suicides increasing? What do suicide rates look like? And that's challenging, because the answer is we don't know. I was just at attended virtually a conference just last week. It was a national conference for suicide prevention, and it was the topic of the conference. And what we all, suicide people from around the world and country, realize is we can't predict what's going to happen next. And so right now, everybody is just doing their best to prepare, to plan, to find, again, like I talked about earlier, but find ways to engage our community, to make sure that people are feeling connected, to make sure that we have resources out there, and that people know of resources. And how do we connect people who don't have tools like Zoom? How do we connect, our vulnerable populations? How do we take care of them? And because, again, we don't know what's going to happen. And so we're just trying to prepare our communities for what might happen.
So Kimberly, I know that you have done this work for a long time. Mm-hmm. And so you have seen many crises over, a period of years, and I'm going to guess that usually they are connected to some sort of an event, mm-hmm. But not always. And so just historically from your experience, are you already seeing an increase in suicides associated with this event?
In Weld County, so I don't have data for the state of Colorado. I don't have data for where I live in Larimer County. We don't really have up-to-date data for Weld County because our healthcare system is so inundated, because our coroner's office is inundated. So the connections that I have had, the contact that I have had, tells me that our suicides as of today have not increased in Weld County related to this. But again, we don't have real-time data. It might be next year before we know what the impact actually looks like. But from the information that I have as of today, what are we, 6 weeks out? I don't know. Who knows? Yeah, but our rates haven't. Now that's not necessarily true for the nation. Nationwide, some places are reporting higher incidences, other places are not. Again, it's really hard to have that real-time data when all of the places where we would collect data are being taken over with COVID.
Sure. And so what are your thoughts as far as the rural experience with the pandemic? Are you seeing any difference in the rural parts of Colorado, or do you feel like it's just universal?
Yeah, it's so hard to say. One, because I don't ever want to compare people's pain. We don't want to compare suffering because we can't. But we do hear from rural workers, from agricultural workers, the fears and concerns with the economy, with financial stress, with what's going to happen if different parts of, different areas shut down, different workplaces shut down due to this. We know that it's impacting people pretty universally, but what that impact looks like, and again, we can't compare one person's suffering to another person's. I think that right now everybody is suffering in one way or another.
Certainly. Yes. Thank you for that perspective. I really appreciate that. So how do you think that this will change or alter your work in the future?
I think I wish I had a more, I don't know, nice way to say this, but I think that it's going to prepare us for if something like this happens again, that it's given us the gift of knowing what to do if this happens again. Not that this is a gift. Again, I don't know the better way to say that. But it certainly is going to teach us how to do things virtually. Now, I have this great example of how this, has impacted our work in a positive way. Is we have support groups that we offer to the community at no cost for people who have lost somebody to suicide. And we have had more engagement in those groups because people don't have to travel as much, because they are at home, they are able and do have the time to join those support groups. And so it's really shifted our thinking of, should we be offering this online always? Is that something that we just continue to do forever? Do we offer an in-person group for those people, when we can, for those people who want to have that face-to-face connection, and then also offer a virtual option? So it's really opened our eyes into some of the different opportunities that we have that we haven't really looked into, just because we've done it the traditional way, the way we've always done it. I think with trainings, it's the same thing. We do a lot of community training. About half of our program is community training. And so what those trainings look like online, is it more accessible to people if we do it online? That's certainly something that we're aware of. We're also aware of those people who don't have accessibility to internet, to computers, to smartphones. We're aware that that population is kind of being put in a box when the only option we have is the virtual option. So it's really made us rethink the way that we're offering services, and how we're connecting with people.
Thank you. I appreciate that. So how do you feel that this will impact the healthcare system as a whole? And I know that your behavioral health and specifically suicide prevention and support, however, you are so much a part of that greater picture. And so I'm just curious how you feel that this would impact the healthcare system.
You know, I think well, when you ask that question, it makes me, I know the question was about healthcare, but it makes me think of our teachers, right? Is that so many people were like, wow, look at the work that they're doing. And I think that this is putting a spotlight on healthcare workers, a spotlight on behavioral healthcare workers. And I think it's putting a spotlight onto the how much people need and how little, not little, we have lots of resources, but how much we need more resources. We need more funding. We need more help. We need, you know, it's a human problem, and humans aren't going anywhere. We deal in social services, we deal in humans, and we need humans to help humans. And so when I got one of those newsletters from one Rocky Mountain Crisis Partners who runs our Colorado crisis line, and they mentioned how there is an increased volume of people calling the crisis line and needing more support for that. And so I just think that it, like I said before, it really does put that spotlight on how much more help we need. And so I'm hopeful that people will see the value in the services and one, access the services and see how they can help both, you know, mutually, how we can help them and they can help us, if that makes sense. Mm-hmm. Felt like I kind of tripped over that one. But.
Oh, no, that's great. Thank you. And so how can we best use the lessons learned from this event to improve education, both for healthcare and for behavioral health?
You know, I always, when I'm talking with, I guess, anybody, I always talk about growing pains. And this is hard right now, and it's ugly, and people are hurting, and people are suffering, and people are dying. And from that, I think that there's always opportunity to grow and to learn. And I think that we have so many people who are passionate and so many people who are compassionate in our communities and in the community work that I do with the numerous nonprofits that we work with. I think that a lot of people, you know, are being innovative and creative and finding new ways to do the old work. And so I think that I think there's lots of lessons that we're going to learn from this. I think that we'll learn how to better connect to people. I think that in what I've been told from family members and friends and coworkers is that we're really learning what it means to slow down and speed up at the same time. You know, so many people are stuck at home and they're having time for self-care. They're having family time. They're also having challenges with being stuck at home. You know, it's like the double-edged sword. And so I think that there's just so much opportunity for growth, and what comes out of that in a positive way, I'm excited to see.
Thank you. Yeah. So how have you maintained and demonstrated compassion during this time?
You know, when I think of how we maintain our own compassion and what our capacity for compassion is, I think it's important. Self-care matters. I know it's like a catchphrase right now, but I think that to maintain compassion, we have to have compassion for ourselves. We have to find ways to make sure that we are giving from a surplus and not from, you know, an empty well. And So some of the ways that I've maintained compassion, for me, a lot of that is giving back. How can I be of service to others? How can I be involved in, outside community organizations? So outside of my position, I still volunteer with other groups and do online groups, and I'm trying to find ways to, help my neighbors and my family. And I think that a lot of people have done that. I don't think that I'm unique in that at all. And I think that compassion, I think more people, at least in my experience, have more compassion right now than before. I think that when we see global suffering, it is kind of bred into us to be givers and caretakers and to give back to our community. And so whenever we see communities that are in pain, I think that the people in general, I have this strong belief that people are good and that they care, and to see how much support North Rank has gotten, to see how much support so many different organizations have gotten from other community members, individuals, and groups. I just think it's a beautiful example of maintaining compassion or growing compassion right now.
So how are you exercising leadership during this time?
Our community coalition that we participate in has really given us the opportunity to use some leadership. A lot of people are leaning on us as a coalition. They're leaning on North Range as the community mental health center. Where do we go? What do we do? How do we do this? How do we take care of our mental health? And North Range has just done a fantastic job at giving the community opportunities to learn about mental health and engage in mental health. They are doing coffee with a counselor on Facebook. They're offering sessions to a few different really big organizations whose employees have been impacted the most by this. And so I think that showing people what, it's kind of like, with parents, it's you model the behavior you want your kids to have. And I think that North Range has done a fantastic job about modeling what care and compassion and mental health and self-care look like by giving back to the community, by offering free sessions for affected community members, by hosting events that anybody can participate in.
So what has surprised you the most?
Oh, that's I think, I'm like, how much I like working from home? I don't know. I think what has surprised me the most, I was going to say how well people have come together, but that doesn't actually surprise me, because I feel like people do that a lot. I think that and I said this just a minute ago, is when we're in crisis, we come together. I think that's a tough question. What has surprised me the most? I don't know.
Well, let's come back to that one.
Okay.
What have you learned about yourself and others? And you might have already answered that.
Yeah. I have learned, and this is just really just a very personal statement and observation. I think that people, at least the people in my circles in my life, have appreciated the opportunity to slow down and have appreciated the opportunity to have some more time with their families and to themselves. And that, I think that that surprised me, is how much people needed that, and how much we didn't realize we weren't doing that. I thought I was great at self-care, and all of a sudden I have more time in my life, and I'm like, oh, I have more time for all these activities, and yeah, I think how much we need to value time or didn't value time. I don't know.
Yeah. So what activities are you delaying or deciding not to even participate in
Mhm.
during this period?
Oh, we had a couple conferences scheduled that we had to delay. We just don't have the capacity or the funding to put the entire conference online, to do it virtually. I think the biggest thing for us that we've had to delay is training. Like I said, it's a huge part of what we do. So we've had to put a lot of that on hold. And because we're doing suicide prevention trainings, um, we have a real safety component to our trainings, where we oftentimes have people in our trainings who are at risk. And so we want to make sure they're safe. And so rather than doing it in person, we're choosing not to right now.
So, same question applied to your personal life and family.
Yeah. So what activities, let's see, with my personal life and my family, my family, my brother and my sister, their spouses and kids live in Denver, and it has been, they're an hour and a half away. And I used to see them a couple times a month, and that has been really hard
Mm.
to be so close to my family and to not be able to see them. I've missed 2 birthdays of nieces and nephews, and that's been a challenge for me. They're, little nuggets. They're my favorite people, and so to not be able to be there with them has been hard. We do Zoom charades though, which
Oh,
is fun. So
that's
yeah,
great.
but certainly those, activities with families and friends where we used to gather, it's been hard.
So, I'm sure that you are the sage when it comes to behavioral health in your close circle of friends and family. That's just typical. People look to you, right?
Yeah.
And so, what do you tell your mom and your kids and your family about this event?
You know, I think that for me, what I have found is transparency is important. I think it's Brene Brown who says clear is kind. And so with the little people in my life, it's making sure that we're answering their questions to the best of our ability in a way that they can understand, that we're not hiding things from them. Um, and and with my, the adults in my life, I think that we see this law is a lot of times this is a situation we have no control over.
Mhm.
Now we are out of control. We don't get the opportunity to make the decisions about this. And so trying to name those fears and recognize them and share them with other people, and not hold those fears or anxieties or stresses, not hold them in, but share them, you know share them out and talk about them. It might seem cliche to say that, especially as a therapist, like talk about it. But it works. It's worked for me. It's worked for my families to just share it out. My 2 sisters and my sister and sister-in-law and their kiddos, they have school-aged kids, and so just every day they have a call where they're like, all right, what are you doing for school today? How are we managing this? And it has been so helpful for them to just be able to kind of dump with each other, and don't hold it in. So I would say transparency and let it out.
Yeah, absolutely. So, as far as coping strategies, what do you do to decompress
Yeah.
outside of work since work is now at home?
I was just telling one of my coworkers, I have a meditation chair over in the corner, and it's literally like 3 feet from where I'm sitting right now. And I will, when I need a break, I just like stand up from this one and go over to that one, and in just 5 minutes of meditation between Zoom meetings, if we can, just to reset. I really like to start my day with meditation. I also really enjoy going for walks. So walking my dog, checking in with a friend. I have a couple close friends that I check in with pretty regularly. I have found that long baths and reading a book cup of tea. All of those are like my comfort blankets.
Mhm.
So, starting my day out with a book and a cup of tea in the meditation chair or ending it that way, and I'm a happy little clam.
Great. I love it. So, Kimberly, this is a really good question, and I love to hear people's answers to this because we have a global event, pandemic, as you mentioned. We can't shut it off. We don't have any control. And so I'm really grateful that you were willing to provide some time to do this interview because this is our way of memorializing this event. And so I want to ask you, what would you want to do to see history record this event?
What would I want to do?
Oh, let me say that again. What do you want history to record about this event?
That is a great question. I don't know if it's my mental health lens, the work that I do. I would want them to record people coming together. I would want them to record how even in social distancing, even in stay-at-home orders, I have seen people come together in ways I've never seen before, and it's so beautiful.
Mm-hmm.
It brings me to tears to see how people are taking care of one another. We have a program, I think it's called Sewing for Hope or Hope Sewing in North Range.
Mm-hmm.
I'm sorry, I can't remember what it's called, but we have this beautiful program where people are sewing masks for our healthcare workers, and it's just, it started a couple weeks after this started, and they come in every day. We're getting new ones, and it's just so beautiful to see how much people are taking care of one another, and to see them lift each other up, and to see people supporting small businesses, and to see just people giving back in ways that we maybe don't normally stop to think to do. And so I would certainly want to record the good of people during this time.
That's so great. Yes, I believe that too. And so this is the end of my questions. However, I wanted to give you an opportunity to just share any last thoughts or anything that's really important to you that you wanted to share for this interview.
I think that the one thing that is important to me, and again, just because of the work that I do in suicide prevention, is just making sure that people know that there are resources out there and know that prevention work matters. And it's so important to make sure that people in our communities are engaging in preventative activities, because we don't know what's going to happen. But what we do know is that there are tools and there are resources out there that can save lives. And so prevention, I guess my last message is prevention matters.
Well, thank you so much, Kimberly, for your time and for all of the work that you do. What you do is really important and difficult, and not everyone can do what you do every day. And I really appreciate you, and I appreciate what you offer and do for the communities. You aren't just providing support for one community. You are all over the place.
Well, thank you so much for this opportunity. I really appreciate it, and for the work that you guys are doing to memorialize this. I think it's important. Thank you.